Kelsey is a very gifted athlete, and by her junior year in high school was being recruited by virtually every Division I basketball program in the United States. Unfortunately, between her junior and senior year, she was playing in a basketball tournament in the eastern U.S. and sustained a shoulder injury. Like a lot of great athletes, she's very hardworking, very competitive, and she elected to play through this her senior season. She thought she could work around it, basically. And it bothered her whole senior season. Ultimately, she signed with a big Division I program and, transferred to that school and played her freshman year at that school. Did well, she was able to compete, but she felt like she could not compete at the level she was accustomed to. Her shoulder was holding her back. So after her freshman year, she elected to finally have the shoulder addressed. She came to me after the season was over, described her symptoms. I suspected instability. On exam, I noticed that she was guarding a great deal. When I would try to move her shoulder, she was protecting it and holding it in place. And I had the sense that her shoulder was very unstable, that if she were not guarding it, it would not stay in the socket. The ball would slip out of the socket. And MRI did confirm a tear of her posterior labrum. The shoulder is a ball and socket joint, and it's a bigger ball and a smaller socket, much like picture a golf ball sitting on a golf tee. Well, that would be inherently unstable because the socket is small. In order to improve stability, the shoulder is deepened by a rubbery ring around the entire socket called a labrum. This deepens the socket, increases the concavity, and creates a suction effect. And it's also where the ligaments attach that hold the ball in the socket. So it's a very important structure. I felt like we could best fix this arthroscopically, which is a minimally invasive technique where you make small holes in the skin and put a lighted tube through the hole in the skin, and it allows you, it's connected to a camera, and you can see inside and cut and sew and implant screws and suture damaged tissue and repair things arthroscopically. And this is a good way to address the labrum tears that Kelsey had, the stretch in her rotator interval. Our goals were to, first of all, get her pain-free, and secondly, we wanted her to be functional. We wanted to eliminate her apprehension. She had this need all the time to contract her muscles and hold her shoulder in a certain position to avoid subluxation or dislocation of the shoulder. So we wanted her to be pain-free, functional, no longer apprehensive, and she's a young person. She's going to need functionality throughout her life for decades to come. And finally, we wanted her to be able to functional enough to compete in Division I basketball. There's a lot of big girls out there, and she was going to need to get into the paint and mix it up, going for rebounds, and she likes to drive to the rim and penetrate. And we wanted her to be able to play her game and do what she needed to do with her shoulder. So we took her to the operating room, and after she was asleep and her muscles were relaxed, she no longer could guard on exam. And just lifting her shoulder up, as soon as her elbow came away from her side, the ball dislocated posteriorly. And it was a testament to what a competitive athlete she is, that she had actually played for 2 years with a shoulder that did not want to stay in the socket at all. It was extremely unstable. Upon introducing the arthroscope, her extent of injury was immediately apparent. She had a very extensive labrum tear. Some people tear their labrum along the anterior labrum. Some people tear along the posterior labrum. Some people tear superiorly, or the slap lesion. She actually had torn from the posterior labrum around the back of the socket and across the slap lesion, well past that. So picture a clock face here. She had torn the labrum from the 6 o'clock position all the way up. The slap lesion started at about the 2 o'clock position, past noon and on around to the 10 o'clock position. So it's a very extensive labral detachment. She only had this segment of the labrum, the anterior labrum, still attached. This was going to require an extensive repair. Anchors in the posterior labrum to repair it, anchors in the slap lesion superiorly to repair it, and then we also went up here and closed her rotator interval, which is more over the 10 o'clock position. And by closing that rotator interval, that is the capsule. By tightening that capsule, it essentially pulls up the capsule below it, so it kind of creates a hammock effect that sustains the ball in the socket and maintains its position. And of course, setting the tension on all this was important so that she could still have a full range of motion and still be functional with her shoulder for daily activities and also basketball.